therapy. And cellular therapy is a form of therapy that again you'll hear so much about in the next 5 to 10 years. There are cells in our body that have the capability of growing into different cell lineages. So perhaps one day we'll be able to pluck one hair follicle, send this to a lab, and they'll be able to tissue culture millions. I do as many hair transplants on women as I do men. The pattern of hair loss is different. So this will make hair transplantation open new frontiers to hair transplantation. They've already been able to grow cartilage cells for re-injection. So if you have damage to some of your joint cartilage, they're able to inject living cartilage cells to help with the process. One-day diseases, neurological diseases such as Alzheimer's, such as Parkinson's, may be a thing of the past as they develop tissue culturing techniques and stem cell therapies for the development of neural tissues. So you'll see medicine change very much in the next 5 to 10 years. And LaVive, as I said, is the very first form of FDA-approved cellular therapy.
Is it, all things considered, in your last, let's just say the last 20 years of experience, is that the one thing that you have seen come along that either makes your job easier or has just revolutionized the way that you practice?
This is there are very few treatments that come along that have the ability of being life-changing. Mm-hmm. And tissue culture therapy really has that ability. In some of the previous studies that we did, particularly in scar therapy, this was life-changing for patients when there really weren't any other options for them. And as the field continues and as more research continues into the field of cellular therapies, again, the excitement in this is really growing rapidly. So I can say really without hesitation that this has really been one of the most exciting treatments that I've seen come along in a long while, and I've really seen patients react the same way. It's a very intriguing story to tell a patient, and as I said, we're seeing so many patients. The cost is a bit higher to begin with, but then when they extrapolate what they're spending on fillers, they're really finding that it down the road will be a much more economical way to deal with smile lines than what they're doing right now.
Interesting. So it seems like the cell therapy would be one way to treat, for example, scar therapy. I don't think we've talked very much yet about some of the advancements in laser therapy. Is there anything that you wanted to mention about that?
Sure. Some of the combination laser therapies, as I mentioned, the dot laser, which is a fractionated carbon dioxide laser, is a treatment now where we can treat age spots, improve tone and quality from head to toe. The most common area for women that we treat are the face, the neck, the décolleté. That's the most common areas that are unexposed. Radio frequency treatments in combination with ultrasound, tremendous for melting fat in the body and for body shaping if someone's not doing liposuction. So these two treatments also from a body standpoint have really revolutionized our field.
Okay. Now, one thing that's also occurring to me as I sit here and I listen, and not that this is all exactly reactive, it just happens over time, and some of it can be viewed as maintenance. But you, on the other side of it, as a doctor, what are some of the things that you wish people could or would do a better job of to take care of their skin in the first place?
Well, that's a good point, because some of this falls on our shoulders, and on patients' shoulders. And it really starts with the whole concept of taking good care of yourself from the inside and out, psychologically and physically. So good health starts with a psychological well-being. Thereafter, a proper diet, a well-balanced diet. There's so many fad diets out, and it's from a staying in good shape. There's really not a lot of magic. It boils down to the number of calories you put in your mouth and how many calories you burn through the course of the day. And all of us need a good balance of protein, fat, carbohydrate within our diet. Because our diets aren't full of all of the other nutrients and minerals, having some good vitamin supplement program is also important, and this helps not only our organs function. One of our main organs is our skin. It helps your skin look better as well. So taking care of yourself psychologically, a good diet, supplemented with supplements, in combination with a routine exercise program, a regular exercise program, are really, really good starting points and things that we emphasize to a patient if they're wanting to protect their investment, if they're considering doing any cosmetic work. We really play a role as a coach and an advisor for them on how they're taking care of themselves. Sadly, in Indiana, we still rank very low in the country as it relates to how people take care of themselves. Many people are on very poor diets. Here in the Midwest, many people here don't exercise enough. So we spend a lot of time counseling our patients on finding that balance, on finding that combination that can at least give them a fair start to maintenance.
Very good. Now, we only have 4 minutes left, and I think that's a perfect segue into, I would like to hear more about your center in general. We have talked about the advancements, but somebody who is interested and they come into your office, what are the gamut of treatments that they can expect and the treatment themselves? So tell us about what you guys offer.
Pride ourselves first and foremost in being interested in the long term with our patients, not in just doing something to you. So when you come into our center, you can come knowing that I will listen to you and help you formulate a plan of health and well-being from the inside out. We will listen to you as it relates to what features are troublesome to you, and then we'll offer you solutions and choices that are based upon the science that exists in the medical literature today. And that science can really be broken down into things that you can be doing at home on a regular basis, things that you can be doing from a skincare standpoint with our medically supervised estheticians within our practice. We still have one of the longest running medically supervised skincare departments in the country. We continue to be one of the largest laser centers in the country. I am an alpha and a beta test site to the majority of the laser companies, so we offer laser treatments that have a high intersecting point of safety and efficacy, because at the end of the day, a patient deserves results. And then when it comes time to cosmetic surgery, my surgical associates and I offer really every operative procedure available from head to toe, again, that offers proven and time-tested results. And so we help, when you come, you can rest assured that we'll help formulate a plan. That plan will help you also budget for the procedures in an order that you'll start to see the results that you're seeking. And I think the loyalty factor is also important too. I'm interested in having my patients, as I said, full-time for 20 years.
Sure.
Patients sometimes make a mistake of doctor hopping, and it's really difficult for both parties to establish the type of loyalty that we look for. The cosmetic surgery or cosmetic treatments, you really get what you pay for. And there are very few of us really that practice cosmetic surgery on a 100% full-time basis. So I think it's really important for patients to do their homework as well when it comes time to deciding who they want to take good care of them and not just do things to them.
Wow, that's fantastic. Okay. Well, I just heard we have 90 seconds left, so the first thing that I do want to say is really, Dr. Chernoff, thank you very much for sharing all of that, because it's so easy if you're not familiar with plastic surgery, you just think that, somebody's unhappy with something minor, but it's really, really much deeper than that. And you guys take a holistic approach to really helping, like you said, from the inside out. So I think that in and of itself was well worth our listeners' time, just so that they realize there are doctors out there that really care. And if they're interested, drchernoff.com, drchernoff.com, would that be the best thing that they should do to look up the phone numbers and make an appointment?
Yes. drchernoff.com. They can find information on our website about how to contact us and a lot of information about all the techniques and procedures that we talked about today.
Wonderful. Okay. Well, I'd better wrap it up, or she's going to tell me again it's time to go. So, Dr. Chernoff, again, thank you very, very much for your time, and I hope you get more phone calls, and I'm sure we'll be in touch. And thank you very much for listening to Business Women Connect Radio. And I'm your host, Amanda Fellows. You can hear more about me at amandafellowsvo.com. Have a great week.